Part two now of my interview with the Chief Quality Officer for Desert Regional Medical Center. How's the vaccination effort at Desert Regional, and has the hospital seen a large demand in vaccine appointments from the public?
Vaccinations across the state and the nation are challenging, as you know, getting the vaccine availability. We this weekend are doing the second shots in a series for seniors at one of the local senior centers. And we are working with our community partners, healthcare districts, state agencies, et cetera, to really focus on getting vaccines to some of the underserved communities and those that may not have the transportation and stuff to come into some of our bigger vaccine clinics. So we're working on that. We're working on the permissions and the things necessary to get those vaccines delivered and the strategic plans of how that will get rolled out. And so more information to come on that as it comes up in the next few weeks.
During our recent Vaccine Questions Answered special, Tim Perlich, the Director of Pharmacy Services at the hospital, made a plea for people not to make multiple appointments and to notify the hospital of any cancellations or if they need to reschedule as soon as possible. Has that been a big problem for the hospital?
I think no matter where the clinic is, that is an issue. We try, because there's only so many doses within each vial, and there's refrigeration requirements and things of how long the vial can sit out before it's considered spoiled. We try to schedule who's coming in so that we can make the best use of the vaccines as they come in. When people don't show, it does add to the stress of that, but what we've been doing to counter that so that we have no vaccines wasted is we have wait lists of people that we can call in at moment's notice, or others that were within that age, that bracket that we're working with, and we can bring them in earlier so that we don't waste any vaccine. So it's just a strategy as far as how we're planning and we're distributing to make sure we don't waste. So we just kind of rearrange time slots, but it does make it a lot more cumbersome if we don't know in advance that somebody's not coming.
News came out today that FDA officials say the Johnson & Johnson vaccine is safe and effective. Officials have called this a game changer. So I'm curious, how much will this vaccine help in our efforts to reach herd immunity?
I think the one thing about the Johnson & Johnson vaccine is that it's a one-dose vaccine versus the two-dose strategy that we currently have. Whenever we're giving out the vaccine right now, we have to always keep in mind that person needs to return in 3 or 4 weeks, depending on which vaccine they got. And that can be a challenge for individuals, especially once we are out traveling in different locations. It's going to be much harder to get those same people back 3 or 4 weeks later to make sure they get their second dose. So I think it will make herd immunity more easy to accomplish. It's just a matter of determining how much of that vaccine is available. Where are they choosing to send that vaccine to distribute? And we'll work with what we have.
Before we let you go, Christine, any final thoughts on where we stand today regarding the pandemic here in the Valley?
Sure. I think my thoughts are, I've heard the words cautiously optimistic thrown out a number of times, and I think I'm cautiously optimistic. I will say to the community, we still have not reached down to the lower levels of what we had after the summer, still with 40-something hot patients in the house. At the lower times in the summer, we were at about 20 or under. So now is not the time to completely celebrate and let down our guard. I think we've learned a lot in the past few months. We've learned a lot from our summer surge to the most recent winter surge that we've had. And we just need to continue a little bit longer, but we're hopefully optimistic that later in the summer, we're going to be able to return to a little bit more normal operations. The patients that are here are not quite as sick as they were before. Our local EMS partners are sharing that when they're doing 911 calls, that the patients that they are bringing in are not quite as sick. There's not as many that are in complete respiratory or heart failure when they get there. So I think we're all seeing that the level of sickness of the patients is improving, and we just need to continue what we're doing in the community and support the efforts that everyone has to try and make sure that this really is truly eradicated as quickly as possible.
All right. As always, Christine, we appreciate your time. Thanks so much for joining us.
Thank you, Peter.